I fell asleep last night. Wanted drops on my pillow. Drops on my pillow. I have no peace of mind, and this might never change. Never change. Never change.
Welcome back to Insomnia. So, as we know, medical marijuana is a big thing that's going on. It's turning into a multi-billion-dollar industry, and so a lot of people don't realize that the marijuana that you get on the street is not the same thing as the medical marijuana that you're getting in the dispensaries and stuff like that. And a lot of people are turning to medical marijuana as a treatment mechanism. I know for me personally, I was in a motorcycle wreck in 2014, so I suffer with chronic pain, and I use medical marijuana to help with my pain. And I've been off pain medications for 3 years now? No, I don't take anything.
When she off work?
Yes, when I'm off work. I do not go to work high at all.
Vascular anesthesia.
Next question. Do you go to work high? Are you administering anesthesia
Be all over
under
the
the
internet.
influence?
Okay.
She uses the cream on her ankle.
The cream on my ankle. Let me
She don't want the street drugs. She wants that good. Yeah.
Let's clear that up.
Yes.
It's cream. She rub on her ankle, rub on her hip, and rub on her shoulder.
Yes, I do not smoke it.
All lab tested and legal.
Tell us about y'all business. Tell us about y'all medical marijuana business.
Well, that's the reason why I even got into medical marijuana. Like I'm certified. I'm a certified cannabis consultant. And so I look at the whole mechanism. Like when I talk to patients, I'm looking at their medications because, medical marijuana, it could still interact with some medications. People don't realize that. Mm-hmm. And so we look at everything the patient's taking, why do they need it, and all that stuff. Yeah. Okay. So it's up to them whether they want to smoke it, edibles, cream, drinks, all that stuff.
Okay. So, of course we know the edibles, the uptake is a little longer.
Yes,
it's a little unpredictable.
Yeah.
Big question in the anesthesia world. Rod, would you counsel a case if they were on medical marijuana?
No. Okay.
What are some of your reasons behind that?
To me, I think it's going to help out the anesthetic if they already have their pain control and anxiety at a decent level coming into the procedure. With the medical marijuana, then I don't have to give as much, during my procedure. And then, hopefully their post-op, they're going to be nice and calm and relaxed, and he's happy, I'm happy.
And that's why people cancel. They believe that when a patient come in smoking marijuana, that they're not oriented or whatever. And so one of the questions I do ask the patients, like, where did you get it? What did you lace it with? Because a lot of people don't know that the marijuana that's on the street is being laced with fentanyl, which is why you see a lot of overdoses or whatever. Yeah. Because you can make a huge profit in the black market cutting marijuana with fentanyl.
Yeah, they've been stepping on a lot of these drugs. What do you think about the...
I think it kind of becomes their new baseline for the chronic pain management. If they're high and incoherent, okay, maybe I won't proceed with that. But kind of like she said, you kind of have to get all your information, know what they're taking, explain to them why it's important you be honest with me, not because I need to tell on you, but just for the safety of the anesthesia. Kind of helps plan our case and whatnot.
Question. Do we actually tell on the patients if they come in high, even if it's like from coke or meth or whatever? Do we actually really report them to to the authorities or to someone?
Because remember, our first while we were in school, our first 6 months was in a rural area in Arkansas. I remember everybody. Meth was the thing there. We drug testing everybody.
Florida too.
That's coming in. Yeah.
Well, we're not canceling cases.
Yeah, we're not reporting you to the authorities.
No, we not. Vascular anesthesia does not snitch, and I don't know what they do at USAP or UT. They probably snitching over there.
We will educate you.
Yeah.
We will educate you.
Yes. we're great at educating, but we don't tell on you. No judge zone.
We won't have the
here.
police pick you up after your procedure.
Yeah. So
But I do think this is a big topic in the anesthesia world that we all need to actually educate ourselves about because it is becoming the new normal in most states. Like Shleisha said, that you actually have to ask a lot of questions or whatever. How much do you smoke? Are you smoking blunts? Are you smoking joints? You know, is your stuff lab tested? And people don't understand, like, when you say lab testing, they looking at you like, lab tested? Yeah, wherever you get your cannabis from, you should be able to get lab results.
it's like a mutant weed or something.
Listen, you know, a lot of people be getting caught up. Like people who are on probation, they're taking CBD, they're buying it in the gas station. You're not realizing that full spectrum does contain a little bit of THC.
Yes.
Or whatever. So if you don't know that, then you're just going to take it, and then you get drug tested, and then you're like, oh my gosh, why? Because I had this one girl, she came to me, she said, I failed my drug test, I'm about to go back to jail. And I said, well, what did you take? And I said, oh, this full spectrum. It has a little bit of THC in it. Take it to your parole officer, and I'll go with you, and I can explain and educate him on why you didn't pass his drug test or whatever. But she got it from somebody else. She didn't get it from me because I educate my people on all products.
Yes. But like Lee said, I think it's becoming a baseline
Yeah.
from where we going. I mean, every state, a lot of states, not every state, a lot of states are legalizing it, even though federally it's not legal.
Right.
But statewide, it's starting to be legal, which I think is great, pretty much a good investment opportunity. We'll have another show on that, on how we can jump in this investment thing and how we can advance ourselves in anesthesia beyond the operating room. So,
It's kind of the same concept with anxiety pills or chronic pain patients with pain medicine. Of course, take it because we don't want to start way behind with the anesthetic. Right. So, like you said, the baseline, same concept with the medical marijuana.
And that's what we get into, like a lot of tit for tat with anesthesia providers. Now, patients can take their Xanax, hydrocodone, but then you cancel them for smoking one joint.
exactly. And it's not crack cocaine
Yeah.
Right.
or heroin.
Yeah.
Even though we're using
Laced.
cocaine in ENT procedures.
Yeah, we do.
We absolutely
We do. We talked about that one time.
Yeah, we talked about that.
We
That's on
we
the
get
previous
on-
show.
Yeah.
When you do your sinus
We give
surgery.
them that 4%.
We absolutely do.
But guess what? You know, of course that method is different. I mean, cocaine and crack and heroin. You take that before a case, you probably go get your case counseled after we run an EKG.
You
Totally
get
different. They probably
No answer, but
Look.
you are canceled.
you counseled because he coming in there looking around. He on meth and his heart rate is 200, and you looking like, what is wrong with this guy? What is really wrong with this guy?
Can't be baseline.
This can't be. This is not baseline now. There's something wrong with him. And then he's sitting there looking at you, and it's like, really? No, this is not marijuana. It's a little something different. But yeah, this is a huge discussion. Marijuana is, and everybody has a question about it because it's becoming a new norm, right? So
And who's taking it mostly now? Elderly patients. They're tired of taking all those other drugs or whatever.
it make them constipated, and
Yeah.
then they got to go get bowel surgery, and then they taking Xanax and give them dry
you never
mouth.
been constipated from Norco or whatever, I'm telling you, it's the worst feeling ever when you're on these narcotics.
Yeah.
And you end up with constipation. That's the worst feeling ever. And I'm in a wheelchair, can't move, and I gotta depend on to give me an enema.
Oh,
The worst feeling
the
ever.
enemy give me look. Yeah, I smoke weed. I didn't take all those medications they told me. That's, you know. But grandma been smoking weed, right? And been fine. Been living from 95 and Crown Royal, be fine.
Okay.
Then you got some person that come over there and on hydrocodone, they hurting forever.
Yeah, exactly.
So it's crazy. You know?
And like what you said with the edibles, it is unpredictable. Like most people, they take a gummy and then they'll realize, oh, it's not working. And then they'll take another one and then you wonder why you high as a kite. You know, you gotta take that one gummy and give it a good hour to see how it's gonna work on you.
Well, big topic, medical marijuana. We'll be right back.
I fell asleep last night, wanted